Dr. Wood, you are recognized.
Thank you, Mr. Speaker and members. I rise in support of SB 277. Wasn't going to speak this morning, have engaged on this issue with a huge number of people over the last few months. At the end of the day, vaccines are safe and they are effective. The CDC credits 10 great health achievements for extending life expectancy by 25 years, and immunizations are one of them. At the end of the day, there are people who will probably never agree with the science. I agree with the science. There are the evolution of the discussion around this issue has gone from science to education to civil liberties. At the end of the day, there are a group of people who will never, ever agree that vaccinations are appropriate. I've heard from my colleagues here that vaccination rates are at 90%. What does that mean? It means it's 5% below what's necessary for herd immunity. It means that a lot more people are at risk, and it's not getting better. Measles, while everybody says it's a childhood disease, can be deadly. The World Health Organization said that recently, as I printed this out the first part of June, the increase in vaccination for measles has resulted in saving approximately 15.3 million lives worldwide. That's a big deal. The children who were stricken with the measles from the Disneyland outbreak, 20% of them were hospitalized. This is not a trivial disease. We may disagree on some of the science here. We may disagree on how we deal with education. I've heard today from some of our colleagues about rights to choose, which are diametrically opposed to discussions we had on this floor around pregnancy crisis centers when we were talking about women's right to choose and getting good information. We have all sorts of contradictions on this floor, and it's challenging to sort it out. But at the end of the day, I had patients in my practice who suffered polio. I don't want to ever see another person suffer polio. I've had patients in my practice who may have had a reaction to a vaccine, but a fever is not a serious reaction. I'm not discounting that there are reactions. There are reactions. There are risks. We heard that 80% of people who get the pertussis vaccine may get pertussis. That may be true, but when you look at the number of people who potentially didn't get pertussis, that's where the public health is served. So I ask you to think about science. I ask you to think about the big picture, and I ask you to consider and vote yes on SB 277. Thank you.
Thank you, Dr. Wood. Mr. Cooper, you are recognized.
Thank you, Mr. Speaker. I rise as a co-author in strong support of SB 277. This is an issue that affects children throughout the state of California, including in my district in San Joaquin County, where a child obtained measles last year. This issue is a matter of public safety and health as well. We have a duty to protect our children from diseases that were once deadly and unpreventable. It's ironic, once this bill passed the Senate and came to this House, the groups came out with misinformation about vaccines causing autism in African American children. There is no scientific evidence to suggest that black children are at a higher risk for autism due to vaccines. African American children actually have one of the highest immunization rates. The opposition's efforts to make this a racial issue by spreading misinformation and fear is wrong and shameful. The overwhelming scientific consensus is that vaccinations is recommended regardless of ethnicity. Many black organizations have come out strongly to support this measure, including the National Coalition of 100 Black Women, the California State Conference of NAACP, and the California Black Health Network, and echo their statement that recent attacks on measures have been vicious, unfounded, and distort the science and history of childhood immunizations within our community. Also, I find it very ironic that members in this House and the Senate also have been threatened and their families have been threatened. That is shameful, and that is bad. This is an issue we're discussing and talking about. Do not threaten someone's families or their livelihood or their life. That is unacceptable. It's funny, we pass laws for motorcycle helmets to save people, bicycle helmets for our children. This whole, not everybody, but a good portion of these folks, a small vocal minority, have spread misinformation. In my district, the majority of individuals vaccinate their children. In your districts, the majority vaccinate. It's a good thing, it's the right thing to do. For these reasons, I respectfully ask for your aye vote.
Dr. Weber, you are recognized.
Yes, Mr. Speaker and members, I rise in support of SB 277. And I know this is a difficult issue for all of us because clearly as a parent, as a mother, and as a grandmother, I take nothing more seriously than my right to make choices for my children and my family. But also I know I rise as an educator who's concerned about the education of children. And while we have state laws that require us to educate all children, we know that even in our own state and in our own house, we refuse to abolish laws that expel children because we know how to put children out of school. And we so-called know how to educate them beyond the walls of schools in terms of alternative programs and plans. And so it's kind of disingenuous to stand and say everybody's got to be educated, and then we refuse to pass laws that exempt or that get rid of expulsions for people's attitudes. So we need to be somewhat consistent about our belief in education and our passion for it. I was going to talk about a lot of things regarding education, but most of them have been covered this morning. So I want to take the advantage of my age. And I tell all of you I'm 66 and I'll be 67 come September. And I have the advantage that some of you don't have. I have the advantage of knowing what a world looks like prior to a lot of vaccinations. I can remember as a child that measles and German measles, that they had gotten so specific in terms of the types, were rampant in our schools. And children missed weeks and weeks of school because they had the measles and they had the mumps and they had the chicken pox. And I can remember people's family members who had tuberculosis and slept at night in iron lungs. I can remember those things because they're very vivid in my mind about what happens with childhood diseases and the amount of time left out of school. And all of us in the school felt very vulnerable anytime anyone had the measles because almost it would go through the entire class in terms of us getting the measles. I can remember friends who got polio. And I still have colleagues now who had polio, who still are functioning in the society, older individuals still on the crutches from polio, whose arms are also not functioning because they had polio. So I remember those images. And sometimes in this world that we live in today, we forget that we are covered by immunization. We forget that we are covered, that the health that we enjoy today, the freedom that we feel about walking around and feeling that we are safe is because we have vaccinations at a high level. And we should never work to diminish those numbers by giving all kinds of exemptions because we share the comfort in knowing that we have a safe, healthy environment. Think about a year ago. We've known about Ebola for years, but we never felt it affected us. Think about it. A year ago, everyone in this house was scared because Ebola had come to the United States. I was planning a trip to Africa, and people said, oh, you shouldn't go to Africa because they got Ebola. I was going to South Africa. Of course, they knew nothing about geography. And I said very clearly to them that when I stand in San Diego, I am closer to Ebola that's in Dallas, Texas, than I will be when I get to Johannesburg because I'll be 9 hours by flight from Ebola, but I am 2.5 hours from San Diego from Ebola. What did it say to us? It says that this is a small, small world, that we have a universal community, and we cannot control, even if we think we can, all the folks coming and going. But we can control this environment, and we can provide as much protection as possible because we do live in a small world. I've been to the countries where there is very little immunization. I've seen what happens to families and children who are very, very sick and who die from the lack of care, or who are hospitalized for weeks and weeks, or who have the impact of those illnesses in their lives. We can pretend that it's an intellectual discussion. This is a health issue. We can pretend that it doesn't affect us, and everyone who stood on the floor said they have been immunized, they have been immunized, they have been immunized. Let me tell you, when the polio was rampant through my elementary school and the communities, when they said that they had a vaccine, I don't even know if they asked my mama for permission. I don't even remember. All I remember is all of us lining up to get a shot. And I remember the sugar that came with the pink drops on it. And we lined up in junior high to get that booster shot. Why? Because we know what it looks like when you have someone in your school who has polio. We know what it feels like when you have a disease running through a community. We understand it beyond the intellectual level, beyond the legislative level. We understand it at the personal level. And so I challenge you today to once again understand that we can take these positions. Why? Because we have vaccinations.
30 seconds.
We have vaccinations across the nation. But when we begin to weaken that protection and weaken it, we will feel just like we felt last year when Ebola was in Dallas, Texas. We were all afraid. We didn't know what to do. And we sent our armies in to basically handle it, and now we feel free again. I want to challenge you to protect our freedoms, protect our children, protect our health, and to get beyond the small discussions that we have and really require vaccination in our schools. I respectfully ask for your aye vote for 277.
Thank you, Dr. Weber. Ms. Gaines, you are recognized.
Thank you, Mr. Speaker. I think we can all agree that we have great respect for vaccines and vaccinations, and that the medical profession has made great progress in this area. But I rise in opposition to SB 277. As a mother of 6 children, I have had experience with the adverse reactions related to vaccines, and we actually live with it every day. Though vaccines can be helpful in preventing the spread of disease, I am very much opposed to having the government implementing a de facto mandate on all of Californians and all school-age children, especially considering what I've gone through with my family. As a parent, it should be my choice in discussing with my doctor about my children's personal medical choices without the interference of the government. By the way, all 6 of my children have been fully vaccinated, including my child that suffered with seizures. But it was on my personal timeline after great consultation with our doctor and in consideration and upon the decisions and when she could handle the vaccinations. As a member of this body, I took an oath to protect and defend the Constitution of the United States and that of California. I believe this bill is a violation of my constituents' rights to privacy guaranteed by the California Constitution by interfering with sacred doctor-patient relationships. I'm also concerned this bill will discourage meaningful discussions between doctors and their patients regarding making an informed decision on the health care of their children. We as legislators should be encouraging our constituents to seek out as much information about vaccines so that they can make an informed decision to vaccinate their children. For these reasons, I'm strongly urging a no vote.
Thank you, Ms. Gaines. All debate having ceased, Ms. Gonzalez, you may close on the item.
Thank you. I, too, believe that this is a medical decision that should be had between, like all medical decisions, a person, a family, and their doctor. And that's exactly what this bill allows us to do. I'm not going to go over every misstatement that was made on this floor, but I'll point out a couple things. This bill is not about swine flu. There's no required vaccination for that. HPV is not required under the current schedule, and if it were ever required in the future, there'd still be a personal belief exemption according to this bill. This bill isn't about Murphy's Law, it's about science and public health. We know that the leading experts in constitutional law and educational rights, including the Dean of UC Irvine Law School, Erwin Chemerinsky, perhaps the foremost expert on constitutional law in California, believes this is constitutional. This is a bell-shaped curve, yes, and the outliers are those people who can't get vaccines, those ones who truly can't take the vaccines, and that's who we're trying to protect with this, because a few percentage points makes all the difference. Just 2%. 2% in herd immunity actually has an effect on herd immunity. It is about that 2%. And we talk about the increase in overall vaccination rates. That's true. Thank God for increased access to health care in general, because districts like mine, a vast majority of schools are 100% vaccinated. So I'm affecting that overall immunity where some of your districts, and we won't call them out, are nowhere close. And yet the babies in my district become victims to other people's personal choice to not vaccinate their children. I'm going to close by referencing a story that was forwarded to us from Dr. Catherine Forrest, the medical director of Stanford Health Care's primary care clinic in Los Altos. She told us a story about her 4-year-old hospice patient. Yes, hospice patient, who will die in the next several months of a complication due to measles. Her patient was only 5 months old when he contracted and was hospitalized with measles, too young to be immunized, and a victim of failed herd immunity. By the time he was old enough for immunization, it was already too late for him. And at age 3, he developed a rare complication of dormant measles that will soon kill him. Yesterday, the LA Times reported on many such other rare and devastating deaths caused by SSPE, a secondary form of measles that comes back years later. Every parent of those 15 infants who contracted measles due to a failure of herd immunity earlier this year has to now live with that fear. What's the public health crisis we've been asked? Well, how many cases of measles do we have to go through till we ask? How many healthcare clinics, BART trains, schools have to be shut down? How many subsequent unnecessary and heart-wrenching deaths until we act to improve herd immunity and individual immunity in the state? I again respectfully ask for your aye vote.
Thank you, Ms. Gonzalez. With that, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the vote. Ayes 46, noes 30. SB 277 passes. Members, we are going to move, immediate transmittal to the Senate on SB 277 without objection. Members, we are going to move back to the top of the file. On third reading, file items 24 and 25, pass and retain. Moving to file item 26, that's AJR 16. The clerk will read.
Assembly Joint Resolution 16 by Assemblymember Eduardo Garcia and others relative to blood donations.
Members, please give your attention to Ms. Garcia. Ms. Garcia, you may open on the resolution.
Mr. Speaker and members, I am delighted to introduce a resolution that is far less controversial than the discussion we just had. But it is in the spirit of celebrating June as we proclaim June 5th, 2015 as LGBT Pride Month here in California. AJR 16 is a resolution that is introduced as a response to the FDA's new recommended blood donor guidelines that continue to discriminate against gay and bisexual men. The new proposed FDA guidelines would prohibit all gay and bisexual men who are sexually active within a 12-month period from donating blood. I ask that the federal government, via the Office of the President of the United States, the Department of Health, and the Food and Drug Administration, to revisit these discriminatory policies and consider disbanding the prohibition from gay and bisexual men from donating blood. Members, I have a few joint authors to this resolution. I want to thank them for their support and collaboration on this issue, and I respectfully ask for your aye vote.
Thank you, Ms. Garcia. Mr. Bloom, you are recognized.
Thank you, Mr. Speaker. I stand as a co-author of AJR 16, and last year, you may remember, I authored a resolution calling on the FDA to lift its lifetime ban on gay and bisexual men giving blood and instead create science-based policies for blood donation. Sadly, though the ban was lifted, a little bit of positive direction there, it was unfortunately replaced by a one-year deferral policy that continues to stigmatize unnecessarily healthy, sexually active gay and bisexual men. Today's blood testing technology and screening techniques are efficient and reliable methods for preventing transfusion-related transmission of disease. Blood testing can determine if a person is HIV positive in less than 3 months after infection. So a 1-year deferral simply does not make sense when technology exists to diagnose in a shorter time period. The FDA's new policy is discriminatory, but most importantly, it prevents healthy men from giving blood, even though this country often experiences chronic blood shortages. This year, AJR 16 calls on the FDA to use evidence-based science to establish guidelines and leave prejudice out of public health. I ask for your support.
Thank you, Mr. Blum. Mr. Lowe, you are recognized.
Thank you very much, Mr. Speaker and members. I, too, rise in support of this resolution related to the blood donations, particularly for gay men and the welfare of the public. Members, imagine the insult, the absolute insult that I feel when an email is sent out asking for us to go outside on these Capitol steps to donate blood. Each year, we receive an email asking staffers, members of this body, to help donate blood, to help save lives. And imagine the thought and the feeling that we might have of individuals such as myself, in which I can help stand amongst you and help govern for this state of California, but can't even donate blood based upon irrational beliefs. Not science, but an old belief. And so this resolution calls upon using science to ensure that we have a safe blood supply and the safety of our public. And this also joins along with the American Blood Centers of America, the American Red Cross, and the American Medical Association in asking for this science-based assessment. And so I join my colleagues in asking for your support of this AJR 16. Thank you.
Thank you, Mr. Lowe. All discussion having ceased on the resolution, Ms. Garcia, you may close.
I just respectfully ask for your aye vote.
Ms. Garcia, would you like co-authors on?
We'll open the roll for co-authors. Thank you.
With that, members, the clerk will open the roll. This is for co-authors adding on AJR 16. This is for co-authors, members. There are 56 co-authors added on AJR 16. AJR requires a roll call vote. The clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote.